Hello and welcome to the closing ceremonies of PHYAC's Health Policy Hackathon. We hope you enjoyed the weekend getting to know your teammates, engaging in the workshops, and broadening your understanding of how to address complex health and social challenges in Canada. For those of you who didn't know, my name is Maham Tariq, and I am one of the co-directors of PHYAC, and today I am joined by Jacqueline, the other PHYAC co-director.
Awesome. So we'd like to start by acknowledging the land on which we gather and which the Region of Peel operates as part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabeg and Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples. The land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have the opportunity to work on this land, and by doing so, give our respect to its first inhabitants. So on behalf of the Hackathon judges and planning committee, we were blown away by the policy submissions and the creative solutions teams came up with to address the social determinants of health and further health equity. It was a very close competition, but we are pleased to announce the winners of our hackathon who have joined us for our closing ceremonies to deliver their presentations on their policy solutions. So we currently have a tie for first place. The first place team is Team 31 with their policy brief on Toronto community housing. And the other first place winner is Team 37 with their policy brief on Indigenous maternal health. Our second place team is Team 31 with their policy brief on Indigenous education curriculums in BC. And our third place team is, sorry, give me one second. Is Sharon Tan, Selena Hussein, and Chun Chow on inclusionary housing. So we would like to invite Team 31 to start sharing their screen and give their presentations.
Perfect. Can everyone see my screen? Awesome. Good evening, everyone, fellow delegates, fellow public health enthusiasts. We are Team 31, and we are privileged to be able to share our policy brief regarding Toronto community housing inequities. So my name is Sophia.
My name is Lala Hansari.
My name is Fatima.
My name's Rabia.
And I'm Leanne.
And so for today, we are going to outline briefly our goal executive summary, the current situation, our policy recommendations, as well as implementation considerations. From the many pieces of advice and lived experience which were shared during yesterday's workshops, we came to feel the most closely related to one specific piece of advice. And this was shared with us by Dr. Singer as aspiring public health professionals. Global leadership starts with local leadership. And thus, we've narrowed our focus on addressing the effects of socioeconomic factors on obtaining housing in the Toronto jurisdiction, which is a public health crisis affecting racialized and minority populations.
So looking at the executive summary, we wanted to start off by looking at our social determinant of health, which was housing and access to health services, which are critical in Toronto, especially because of its high population. So looking at our current situation in Toronto, the process to obtain safe and equitable subsidized housing is discriminatory and it lacks data transparency, which leads to uninformed decision-making. Further, our policy recommendations included a provincial government intervention, as well as an EDI, which is an equity, diversity, and inclusion training for staff who are working specifically in providing subsidized housing. And we also included information transparency. So we recognize that these were necessary elements in the application process for subsidizing housing within the Toronto jurisdiction.
We found that there were several problems with the current application to subsidized housing. First off, it seems to be difficult to submit an application in the first place. There is only one physical location, which is currently closed to the pandemic, and the other options are to submit them online via an online application form. But the problem with that is that there aren't really accommodations available to those who may need support submitting an online application. There didn't seem to be any way to request for accessibility needs or to access technology for those who don't have access to printers, internet, or computers. Furthermore, the application form for subsidized housing is exclusively in English, even though there are many more languages that are spoken in Toronto among Toronto's diverse population. Another thing that makes it difficult to meet personal housing requirements is the fact that the Toronto Community Housing collects information such as age, marital status, and income, yet it doesn't collect information on socioeconomic status, sexual or ethnic identity, or disability.
So currently, waitlists for housing in Toronto are expected to grow to approximately 120,000 by 2031 for able-bodied persons and 17,500 for people with mental health requirements. So this is further emphasized by the fact that there are 100,000 households that are currently waiting to access only 94,000 available housing sites. So these long wait lists are a reflection of the lack of infrastructure and misallocation of resources, which is concerning as the population rate of Toronto is expected to double by 2041. And this issue is further exacerbated by the COVID-19 pandemic. So despite freezes being put on evictions that was earlier on this year, evictions were still occurring throughout it. The Landlord and Tenant Board of Ontario conducted 1,431 eviction hearings in January. So what we're seeing is a twofold issue where the wait list continues to grow and people are continued to be evicted.
So for our policy recommendations, we first recommend that Toronto Community Housing collect additional applicant demographic information in order to streamline the application process. And this would help establish a priority wait list so that those who need access to subsidized housing get access to it first.
And our second recommendation is to allocate the appropriate funding and subsidies towards providing accessible services. So to reduce the language barriers, improving access to resources such as the internet and other technological needs, and to be inclusive of persons with disabilities.
Last but not least, we request the provision of equity, diversity, and inclusion training to Toronto Community Housing staff. The EDI training will equip staff with the necessary terminology and resources to interact with clients and also serve a diverse range of applicants through the removal of existing barriers and the inclusion of minority groups. So EDI training topics can include, but are not limited to, bias awareness training and the implementation of training regarding an inclusive workplace.
And in order to enact these 3 policy recommendations, we believe there are 2 key factors which policy leaders must take into account to ensure that there is a seamless, successful implementation. The first is the establishment of a data security infrastructure, which will enable increased data collection. And so this will serve 2 purposes. First of all, anonymizing collected data, as well as storing all identifying data in a secure, unlinked database. And another thing to consider is that we require informed consent. And this is to ensure that there is transparency in data collection so that applicants know the reason why they are sharing such data.
And our second consideration is to allocate funds in provincial budgets toward EDI training within the City of Toronto, and this will provide additional resources for applicants and staff to better help and situate people who require these housing services.
And that concludes our presentation. Thank you for listening.
Fantastic. Thank you so much. That was incredible. And I encourage all attendees, if you're interested in learning more about the policies that were proposed, to reach out to Team 31 to chat. Next, we will have Team 37 present their policy solution.
Good afternoon, everyone. My name is Michelle, and today myself, Christy, Ravneet, and Sophia from the Master of Public Health program at Western University will be presenting our policy brief on Indigenous identity as a social determinant of health, specifically focusing on Canada's birth evacuation policy for Indigenous women. Before we begin, we would like to acknowledge that our policy brief was written by non-Indigenous peoples with no Indigenous lived experience, and thus it may not represent a comprehensive overview of the issues mentioned. The goal of our policy brief was to critically evaluate the birth evacuation policy and provide recommendations to reduce maternal health inequity and poor maternal health outcomes among pregnant Indigenous women in Canada. We have identified our jurisdiction to be the Canadian federal government and our stakeholder to be Indigenous Services Canada.
The birth evacuation policy has been the focal point of Indigenous maternal and child health for the past 3 decades. This policy mandates the relocation of expectant mother to urban hospitals in order to receive basic prenatal care during the later stages of their pregnancy. Due to the detrimental lack of funding in Indigenous communities, a large proportion of women must utilize the service to ensure favorable outcomes, such as a reduced rate of birthing complications and decreased chances of maternal and infant mortality. However, evidence has shown that BEP can pose severe negative economic and health challenges for Indigenous mothers. As such, it is critical for the ISC to address the barriers present to ensure Indigenous maternal health equity in Canada. The harm BEP poses can occur through 2 mechanisms. First, the extraction of Indigenous women from the community during pregnancy disrupts Indigenous knowledge, cultural practices, and care provision. This causes social and cultural isolation, ultimately harming their well-being and health outcomes. Evidence has shown that Indigenous mothers obligated to travel longer than an hour are 7.4 times more likely to experience severe stress and labor complications, while Indigenous infants delivered outside of the community have a significantly higher mortality rate than their non-Indigenous counterparts. Second, due to a lack of effective communication on the part of non-Indigenous healthcare providers, Indigenous women often feel disconnected from the birthing process. Indigenous peoples are known for their nonverbal communication style, which has been perceived as uneducated, rude, or non-compliant by providers who are uninformed. This differences fuels the negative stereotypes and furthers the asymmetry in patient-provider relationships, leaving Indigenous women with poor perinatal health outcomes and a deep mistrust for the public healthcare system.
Considering the current issues we mentioned, we came up with 2 recommendations. The first was to provide resources and funding for on-site traditional birthing practices. Indigenous women and their families need the option of giving birth close to home. Funding is needed to create Indigenous staffed maternity centers with midwives, midwifery students, doulas, and birth workers. Current programs that incorporate traditional practices and Indigenous values have shown significant benefits in reducing preterm birth and cost, increased screening and treatment, immunization rates, and antenatal attendance. Further, this leads mothers to be more satisfied, receive more community support, and reduces family separation and traumatic events. Importantly, there are some implementation considerations that must be taken into account. Transitioning birthing back to Indigenous communities will not fit the needs of all Indigenous women, as they are a heterogeneous group with varying psychosocial and physical needs, and may still need the option to access Western medical facilities. Further, training sufficient Indigenous midwives will take a significant amount of time. The ISC should allocate an increased budget to support Indigenous women during off-site care by covering the expenses of family members who accompany them. Family support plays a significant role in Indigenous culture, and it is essential to maternal well-being during perinatal care. Research shows that good social support during birth is also associated with having shorter labor, better pain control, and less need for medical interventions.
Our second recommendation is to foster cultural competency through bidirectional communication between Indigenous patients and healthcare providers. Cultural competency should be emphasized to create a safe and supportive environment where Indigenous women's voices are valued while receiving care. This can be done through facilitating effective communication, as it has been shown to enhance Indigenous patients' experience of care, power equality, and relationship of trust. As such, the knowledge of Indigenous values and practices should be incorporated into healthcare providers' training curriculum, which should be also developed by Indigenous peoples. This education should provide a comprehensive understanding of Indigenous health and include topics such as social determinants of health and Indigenous history and culture. Such curriculums have shown to be effective in improving confidence and knowledge to deliver care for Indigenous people in the United States and Australia. However, considering a potential delay in improving clinical maternal outcomes through education, in the interim, the ISC should incentivize integrative healthcare teams with equal representation from clinical, community, and midwifery members. This can mitigate communication gaps and optimize the use of Indigenous resources. Additionally, this team can collectively come to a decision on whether an evacuation should be done, such that mother's social, clinical, and emotional risks are valued.
According to the National Aboriginal Council of Midwives, an Aboriginal midwife is a committed primary healthcare provider who is knowledgeable in all aspects of women's medicine and is a keeper of ceremonies, a mentor, and someone who passes on important values about health to the next generation. This quote illustrates the importance of incorporating culturally appropriate care into the area of maternal health care. An example of this care is an Aboriginal midwifery program, which is an essential component in the promotion of Indigenous maternal care because it creates a safe and supportive environment in which Indigenous women feel a meaningful connection to their communities. This highlights the need for improved coordination and integration of Indigenous women in maternal healthcare services by returning birthing practices back to Indigenous communities. Access to culturally appropriate healthcare and maternity care services are important contributors to positive maternal and child health outcomes. There is a critical need to reevaluate the delivery of maternal healthcare services for Indigenous women. The recommendations in our policy brief are intended to explore the improvements that should be prioritized and present a call to action for the ISC to improve overall maternity care services for pregnant Indigenous women. Adopting Indigenous childbirth knowledge and customs within the healthcare framework, implementing culturally competent training for healthcare professionals and delivered by Indigenous community leaders, and building capacity in Indigenous communities for traditional birthing services will contribute to achieving equitable maternal healthcare in Canada. And before we go, we would like to extend our sincere thanks to our colleagues Cynthia, Harris, Theodora, and our professor, Dr. Danielle Elcock, for sharing their knowledge and insight on Indigenous maternal health throughout our graduate program learning. Thank you so much for listening.
Thank you so much. That was fantastic. We really appreciate you sharing your policy brief on this extremely important topic. Next, we would like to invite our second place team to either share their screens or begin their presentation.
Yes, I will share my screen now. Awesome. All right, so hello everyone, and thank you so much for tuning in today. We're really honored to present our brief to everyone, and so grateful that we got second place, and it's been a privilege to hear everyone else's briefs as well. So thank you so much. Our group, myself and my colleague Navneet will be presenting today, but we want to acknowledge that this brief was done with both of us, as well as Jazz, Sabrina, and Sahar. So just us will be presenting, but it was a team effort. That being said, our brief was about the dire need for the revamping of British Columbia's education system to include the history and realities of Indigenous peoples in Canada. And this was a really important topic and one that our colleague Jazz brought up. And we want to start by saying that, again, we are settlers on this land, so this might not be a comprehensive overview of the issue. So just keep that in mind as we go through our brief today. So one of the main facets of our recommendations today is based on the fact that in 2016, British Columbia did revamp the education system. However, it's currently largely inadequate for representing the entire history and realities of Indigenous people today. And it fails to recognize the colonialist history that British Columbia and Canada as a whole has had historically. That being said, we're going to go through our context as well as our recommendations, implementation considerations, and a brief conclusion to finish this off. So Navneet will get started with the context.
Thank you, Anjali. So systemic racism, lack of access to healthcare, and inadequate housing are some of the major disparities that are faced by Indigenous people in BC and overall in Canada today due to the social systems and institutions that continue to fail them. And these disparities have been exacerbated by the current COVID-19 pandemic. To improve health status, employment and income, and other social determinants of health, research suggests that revolutionizing the existing education curricula in BC is imperative in addressing systemic inequalities and health disparities experienced by Indigenous peoples. These programs are vital in combating systemic racism and reconciling Canada's colonial past. In 2016, the BC government launched a new public school curriculum with a focus on Indigenous history, culture, and views. This was in response to the TRC's 2015 report, which recommended that Indigenous history be incorporated in education to help combat the discrimination that they currently face. However, the new curriculum is unclear and does not include specific lesson plans for teachers to follow, leaving them feeling unqualified and ill-prepared to teach many of the critical concepts. And furthermore, many of the students of Indigenous heritage feel pressure to guide teaching, which forces them to relive generational trauma and discrimination or justify their culture to settlers. By failing to incorporate standardized lesson plans informed by Indigenous voices, students cannot thoroughly appreciate the history, culture, and values of Indigenous peoples in BC. Keeping this in mind, we came up with two recommendations. The first is to address these gaps. The Minister of Education of BC must urgently mandate a mandatory Indigenous history class such as BC First Nation Studies 12 for all students. This class should place importance on the voice of Indigenous leaders and elders, Indigenous ways of knowing and being, and the relationship between Indigenous and non-Indigenous people over Canada's history. And our second recommendation is a call to action that would mandate that standardized Indigenous teachings be incorporated into existing classes rather than independent compulsory courses. Standardized Indigenous teachings will ensure students have the opportunity to learn Indigenous perspectives throughout all high school courses and across various disciplines in BC. Relevant subjects at the grade 9 to 12 level include English, history, geography, law, and justice studies in which teachings would be incorporated. This method allows educators to meaningfully incorporate both Indigenous worldviews and content within their specialization, and these would be adapted to integrate new and contemporary systems of knowledge that challenge the Eurocentric point of view and form the basis of the contemporary school system. And now I'll pass it back to Anjali.
Great, awesome. So as mentioned, our two recommendations are mandating an Indigenous history class. Currently, right now, it is an optional course that high school students can take, as well as standardizing Indigenous teachings into every existing class. And there are a few things that you want to consider when implementing these recommendations. So for currently right now, there are Indigenous studies classes that teachers can teach, but there is a lack of clear standardized lessons plans for teachers to follow. So we, within our implementations considerations, we really recommend creating standardized lessons plans with which have been heavily informed by the voices of Indigenous leaders and Indigenous peoples, especially in BC, just to make sure that all the teachings are incorporating accurate and culturally meaningful information. As well, we want to make sure that high school students are learning Indigenous teachings within every single class. So working closely with teachers of special subjects and pairing them with Indigenous elders and leaders in those fields would be especially helpful to create these standardized lessons plans. We also want to reiterate that BC is home to over 200 distinct First Nations peoples, and therefore course materials like textbooks or workbooks should acknowledge, respect, and satisfy the diversity within Indigenous communities within BC. And they should consider this diversity in order to capture the realities of Indigenous peoples in BC. So overall, we want to conclude by saying reconciliation is an ongoing process that we are all on. So this is just a first step to respecting, acknowledging, and revolutionizing Canada's relationship with Indigenous peoples by hopefully learning and incorporating Indigenous studies within the education system and mandating that these courses be taken. We can hopefully use this comprehensive education to combat discrimination that Indigenous peoples face today in BC and all over Canada. We also hope that by starting in BC, where a third of the First Nations peoples in Canada's live, we can hope to learn from BC and expand this system to all of Canada and to all provinces across Canada, because there are many provinces currently that don't have even Indigenous studies courses. So we need to make sure that we are learning from one province and expanding that to all of Canada, because Canada's colonial history is widespread and not just located in British Columbia. Thank you so much for listening to our presentation.
Thank you.
Thank you so much, Anjali and Navneet. We really appreciate you taking the time to present your policy brief. And last but not least, I would like to invite our third place team to give their presentation on their brief.
Hi everyone, my name is David, and together with my teammates Selena and Sharon, we chose to create a policy brief. First of all, thank you for the delegates for facilitating this opportunity for us, and also for our fellow speakers for presenting really important and creative policy solutions. So our team chose to explore a long-standing issue, which has recently gained traction during the pandemic, which is housing insecurity in the Toronto metro area. So our policy brief provided evidence-based policy recommendations for reducing barriers to high-quality housing and living conditions in urban centers. And we set to recommend a certain standard of living for vulnerable populations and the Toronto population as a whole, in which we're going to have our provincial government coordinate municipalities at multiple levels to be involved and collaborate in order to facilitate change that can meet a diverse set of community needs. So we found that over a long period of time, but especially recently, there's been a lack of affordable and safe living spaces that has increasingly affected the health and well-being of different individuals, families, and communities across the GTA. And we know that substandard housing includes, I guess, precarious conditions where people result to living in transient living situations or structures that are crowded and may lack access to fundamental resources like clean water and proper sewage. And those living in substandard housing conditions are more likely to have increased risk of compromised health. They're more often compromised in their day-to-day functionality or ability to access economic opportunities or needed health services. And oftentimes individuals without a set postal code also have to constantly travel for temporary services and employment. So what we have kind of brought light is that inclusionary housing and zoning policies will have new residential developments to incorporate affordable housing units and mixed income neighborhoods. which would tackle a major issue in the Toronto area, which is different segregation of neighborhoods, where the quality of housing care and the quality of healthcare in general are much different depending on your postal codes. So what mixed income neighborhoods do is that it incorporates low income families and higher income families or individuals together in a certain unit with multiple units in a certain neighborhood and kind of integrated together within a single community. We have research that shows that there's significant health benefits in income diverse neighborhoods, not only for physical health and increased self-esteem, but particularly it affects low income families in a much more positive way because we integrate a lot of infrastructure and services which are otherwise often neglected in low income neighborhoods. We've seen this happen in the United States, where inclusionary housing has been proven to be successful in large cities such as San Francisco and colder weather cities such as Denver as well, where the mixed income housing is able to mitigate segregation along racial, cultural, and economic lines, where a lot of the preconceptions that people may have involving crime or social isolation get removed when everyone gets provided an equitable living standard. Currently, with a COVID-19 pandemic, it has kind of disproportionately affected communities which are already experiencing these pre-existing barriers to safe and equitable housing. So we know that in times of desperation, tenants are often going to do whatever they can to accept stable housing. And in these situations, landlords may take advantage from policy loopholes to either ignore essential renovations over time and allow residents to have to accept substandard living conditions, or they may implement aesthetic renovations which are non-essential and meant to price tenants out of their homes. And in addition to this existing problem, new units are not prioritizing the needs of low income communities, but instead usually prioritizing luxury high-rise apartments or detached homes, neither of which address a lot of the, not only the needs for a greater number of housing units amidst a housing crisis, but also does not take into account the integration of health services or a proximity to economic centers. We've already seen that Ontario in the past from 2016 has passed a bill on affordable housing and has tried to involve multiple municipal actors. But unfortunately, because of vague guidelines, lack of coordination and other reasons which we'll go into, there hasn't been a lot of traction. And we feel that now is a perfect time to kind of bring to light a COVID relief response, which may see more equitable distribution of living spaces across mixed income neighborhoods. So what we recommend is that we have inclusionary housing, which requires a fixed minimum percentage of affordable housing units in the development of 1 or 2 apartment units. This is going to be done in collaboration with private developers, which is how the majority, almost 98% of private properties have been made across Ontario. We've seen that this has been successfully implemented in other cities where they've had a minimum allotment for affordable housing, usually at least 10%. And in the Toronto area, this has been 2% up until now. So in order to create the momentum and prioritize a policy action that will address short-term needs, as well as have sustainability in the long term, we want to set at least a 10% minimum floor. We also want to create a public revenue pool for social housing initiatives, where there's a mixture of residential contributions, usually taxing, and funding from developers. This is going to help the collaboration between different municipalities because traditionally, if municipalities are unable to balance their budget, they will usually forego long-term projects, and this is going to include inclusionary housing policy. So to have access to funding from developers, this process can help expedite not only an affordable housing development process, but kind of increase the scale and make sure there's always going to be a steady influx of public funding. So alongside this plan, we're also going to incentivize developers in their market-based developing with subsidies to implement even more than 10% of affordable house units across multiple units again. So we basically provide an incentivization where if they exceed the minimum percentage, 10%, we will partially subsidize it, or they may have the choice of contributing to the public social housing revenue pool. And in return, we can promise that we'll push infrastructure projects in these areas, which will not only improve the property values of the neighborhoods, which the private developers will be incentivized to accept, but it will also help the mixed income neighborhoods and particularly low income communities, which have historically been neglected and pushed into certain geographical corners in the Toronto region. So here we can keep the affordability of the safe housing, and we can also improve the services over time for low income residents, which addresses a lot of the issues that we see with gentrification. But at the same time, we provide these modernized services that are accessible and affordable. So some key considerations is, again, we need to push momentum much above the 2% so that it's the forefront in public discourse. And we need to frame it that this is towards improving Ontarians' living standards toward an equitable outcome, which is not only fair, but meant to help everyone involved. And this has to require a facilitation of a sizable amount of living spaces every year so that people can see tangible change. And at the same time, we need to communicate to the public that a combination of public and market-based development efforts have been proven successful in North American cities in the past. So this is not only going to depend on taxation or contributions from homeowners, but this is going to be a multi-revenue effort, which is going to help homeowners and tenants alike, but have an end result that will allow tenants to live securely. We also have to show to the public that pre-existing biases will not, I guess, come into fruition with these projects. And a lot of the issues that neighborhoods may have, like fear of other neighborhoods or other community groups, are mostly structural in nature. And we've shown in other cities, such as San Francisco, that if given environmental conditions improving for different community groups, neighborhoods, communities, and demographics across the board see better life outcomes. And lastly, we need to regulate and monitor the implementation processes to ensure that both policymakers and developers are held accountable and living conditions are maintained over time and kept safe. So in conclusion, we need to know that we can and we will meet the diverse needs of different communities. And by knowing that inclusionary housing can improve the equity of families and communities in both the short term and the long term, we can recommend policies that may gain public favor and provide the means and the direction for inclusionary housing to be implemented in a larger scale over time. So here we aim to provide protection to low-income individuals, families, and communities to achieve a more equitable housing situation. And from that, integrating it into the wider community with equitable health services and economic opportunities is also paramount from the effects of this policy. And in order to achieve that, we're going to have a collaboration between the different municipalities, policymakers, and developers to facilitate this change with a continuous continuous decision-making and collaborative process. Thank you.
Thank you so much for sharing. And once again, I want to thank you all for coming and for your support and participation over the past weekend. We hope to work with you all and see you all again in the future. Feel free to follow us on social media and email us in case you're interested. We are opening recruitment this week for new positions with the Public Health Youth Association of Canada.
Lastly, we just wanted to encourage you to tune in to our event in conversation with Candice St. Aubin and Jagmeet Singh this Wednesday at 4:15 p.m. Eastern Standard Time to discuss key health and social policy issues in Canada. And you can also submit your questions to ask of our guest speakers ahead of time through the link in our website.
I also want to congratulate and also thank Mobeen Lalani for sharing his experience in the conference using our hashtag PHYAC Hack for Health Equity, and he will be joining us on Wednesday.
So again, thank you for attending the hackathon. You should all give yourself a huge pat on the back for what you've accomplished this weekend by coming together and creating a significant portion of research on critical topics in just 24 hours. It's quite the accomplishment. And we think it's really clear that the next generation of public health leaders is committed and driven. And we encourage you not to just leave your policy brief in a Word document, but to go out and meet with decision makers and stakeholders and enact the change that you would like to see in your community.